Welcome to Face the State. I'm Arianna Bennett. Thank you for joining us. Well, depending on who you ask, as many as a quarter or even half of women will deal with some kind of pelvic floor issue in their lives. And they can happen for a lot of reasons, but they aren't always accurately diagnosed or treated. So Dr. Melissa Dawson with Urology Nevada is here with me to talk about that. Dr. Dawson, thank you so much for coming on the show.
Thank you so much for having me.
It is absolutely my pleasure. Now, first off, and I know this is maybe going to sound ignorant, I don't know, but I think when most people hear about urology, they think about men's health. Are there as many women in need of this kind of care as men?
Absolutely. Women are half the population. So of course we also need urologic health, women's health, pelvic floor health. These are all things that we are looking for. So what I deal with is pelvic floor disorders. More commonly, you'll hear them as pelvic organ prolapse, urinary incontinence, or some form of fecal incontinence. I'm actually an OBGYN that trained in pelvic reconstructive surgery, so I do specialize in pelvic floor disorders, but absolutely women need a go-to, a provider that does this sort of care.
Why is it then, do you think, that prevailing thought about urology is that it's a men's issue?
So many thoughts that come through my brain on that. This kind of gets to what we'll talk about later on, but it's a very deep-rooted, paternalistic answer. I think that men's health in history has always prevailed above women's health, and not until recently have we really started the conversation that women's health is actually very important, just as important as men's health.
Yeah, it's an interesting thing, and like you said, we will talk about it a little bit more, but I wonder if because women are so hardwired to deal with pain and discomfort, especially in the pelvic area, that it just gets overlooked, ignored, and not diagnosed. So in your practice, what do you see most commonly?
You mean the type of diagnoses, or you mean
the issues that people come to you with?
People come to me with. Mainly when they come to me, they're looking for some answers with either with pelvic pain, urinary incontinence, feeling like something's coming down and out of the vagina, feeling like they're sitting on a ball, sitting on an egg, or having issues with urgency of urination, frequency of urination, fecal incontinence, fecal urgency, all sorts of issues. A lot of times they have sought care in the past and haven't received the answers that they need to treat the conditions that they have.
So if we're talking about pelvic floor stuff, I know a lot of people are probably aware that this can be a consequence of childbirth, but that's not the only one, right?
No, absolutely not. I tend to tell my patients that it's mostly genetics, but there actually is a lot of different factors to that. We don't have any proof in the literature that it is genetics, but a lot of times patients will say, well, my mom dealt with this, or my sister dealt with this, and now I feel like I'm dealing with it. But a lot of also external factors, so things like not only childbirth or trauma to the pelvic floor, but conditions like obesity, your diet, exercise status, many different things can affect and play into pelvic floor dysfunctions or disorders.
Really? Diet and obesity. I didn't know about those. That's so interesting. Yes. What dietary factor can impact your pelvic floor?
I think there's no research that says if you eat this, then that would happen to you. I think it's together with impact factor, exercise, how healthy are you? What are you doing? Are you sedentary? Are you a gymnast that started young in life? We know that some studies show that gymnasts, when they were young, the running, the jumping, the lifting, they may be at higher risk for pelvic floor disorders in their future. If you lift heavy things, if you work in an industry or on a farm where you're lifting heavy things, may put you at risk also for some pelvic floor disorders. So,
wow,
yeah,
that's counterintuitive. I think I would have thought if you are physically strong because you've been doing these active things, that all of you would be physically strong, but not so.
think about how we stand on 2 feet, and our pelvic floor has a lot to do. It has to hold in all of our organs. It's the connective tissue, the muscles, the bones that keep all of our insides on the inside. So think of any kind of disorder, especially anatomic disorders like pelvic organ prolapse, like a large hernia. So any kind of increased abdominal pressure that can put any more force on the pelvic floor can increase that risk of pelvic floor disorder.
Okay, so if people are dealing with this, what does treatment look like? How does it work?
So depending on, first we do a lengthy discussion into your symptoms, a very thorough examination. Sometimes we do a workup. But once we create a diagnosis, we do start with the option of conservative management. A lot of time conservative management can be lifestyle changes, as previously briefly discussed, but mainly pelvic floor physical therapy. Yeah, that's a wonderful conservative therapy that we provide.
So how does that work exactly? I mean, is this like more than Kegels?
Oh yes. In fact, it gets me going when people say, "Well, I've done my Kegels, and why is this happening?" There's so much more to the pelvic floor physical therapy than just Kegels. In fact, sometimes when we're dealing with pain, we don't want you to do Kegels. We don't want you to increase that pressure because it can increase the pain. So it's one-on-one with the female physical therapist in a private room. They do external and internal work with you, depending on the diagnosis, your comfort level. But I also say it puts your brain and your bladder, your brain and your pelvic floor back on track.
So how many sessions of this do you need before you can maybe get things, where you would like them to be?
I leave that up to the physical therapist, and every therapist is different and every patient is different. So based on the patient's expectations and based on the comfort level of that relationship depends on how many sessions they do, how often they do it, and they also usually assign some form of homework, so patients go home and do stretching, or they work sometimes with dilators or weights where they actually do these exercises with props.
Wow.
Yeah.
This is all really interesting stuff, but also something that I think a lot of people are very uncomfortable talking about.
Absolutely.
And probably very uncomfortable seeking help with. Do you think there's a lot of people out there who are just leaving it untreated because they are too afraid to say something?
Absolutely. And so I've made it my mission to really go around and depending what area, I happen to be practicing in now, I'm in Reno, so very happy to be here. Really talk to the primary care providers, really talk to the OBGYNs and the urologists in the area and understand if they're speaking to their patients about these issues. I frequently go into the 3 Bs, bowel, bladder, and bulge. And providers should be asking some question about those 3 things.
Okay, so if you are not being asked those questions and you're dealing with pain or incontinence or some other issue in that realm, give you a call.
Yes, absolutely. Would love to see you.
All right, so then just generally speaking, how do we be the best possible custodians of our parts here? Do you have like a habit change, a good thing or a bad thing, something you wish people would do or stop doing for overall health?
Oh gosh, no. I feel like you have to live your life, and everyone has such a different life to live. But there's nothing that we can do preventatively or that we should be doing differently to make sure that we are in the best pelvic health that we can be. Being healthy, eating right, doing exercises, living your best life is, I want my patients, even after surgery, to get back to what they were doing before. There should be no restrictions or changing your lifestyle unless we're going from a very unhealthy lifestyle to a more healthy lifestyle.
Okay, and then just not being afraid to ask for help or ask for an opinion if you're noticing something's different.
Absolutely.
Okay.
Yeah.
Perfect. Well, that's a good opportunity for us to take a quick break, but sit tight because coming up on Face the State, I will be back with Dr. Dawson to talk more about women's issues in medicine and what to do if you feel like your doctor just isn't taking you seriously. Stay with us.